Incidental findings. It's extremely important to differentiate the pain generator from any incidental but dormant pathology, such as degenerative disc disease or disc bulging. I have seen many cases where the patient underwent spine surgery and surgery was not successful because the pain generator was not the area operated on. Over the years, a few patients made it to me before surgery, and we were able to help them without surgery. We love imaging so much in Western medicine that we spend about $15 billion worth in it each year. Although imaging can give a fantastic insight into pathology, it does come with its own negative side effects. For example, studies have shown that early MRIs performed on individuals with low back pain can lead to inferior outcomes, possibly due to the threatening language, negative self-perception, and nocebo that may come with it.